Numerous experiments which were performed on human test subjects in the United States in the past are now considered to have been unethical because they were performed without the knowledge or informed consent of the test subjects. Such tests have been performed throughout American history, but have become significantly less frequent with the advent and adoption of various safeguarding efforts. Despite these safeguards, unethical experimentation involving human subjects is still occasionally uncovered. Past examples of unethical experiments include the exposure of humans to chemical and biological weapons, including infections with deadly or debilitating diseases, human radiation experiments, injections of toxic and radioactive chemicals, surgical experiments, interrogation and torture experiments, tests which involve mind-altering substances, and a wide variety of other experiments. Many of these tests are performed on children, the sick, and mentally disabled individuals, often under the guise of medical treatment. In many of the studies, a large portion of the subjects were poor, racial minorities, or prisoners. Many of these experiments violated US law even at the time, and were in some cases directly sponsored by government agencies or rogue elements thereof, including the Centers for Disease Control, the United States military, and the Central Intelligence Agency, and in other cases were sponsored by private corporations which were involved in military activities. The human research programs were usually highly secretive and performed without the knowledge or authorization of Congress, and in many cases, information about them was not released until many years after the studies had been performed. The ethical, professional, and legal implications of this in the United States medical and scientific community were quite significant and led to many institutions and policies that attempted to ensure that future human subject research in the United States would be ethical and legal. Public outrage in the late 20th century over the discovery of government experiments on human subjects led to numerous congressional investigations and hearings, including the Church Committee and Rockefeller Commission, both of 1975, and the 1994 Advisory Committee on Human Radiation Experiments, among others. Surgical experiments. Throughout the 1840s, J. Marion Sims, who is often referred to as the father of gynecology, performed surgical experiments on infants, enslaved African women, and girls as young as 13 without anesthesia to treat conditions including vesicovaginal fistula, neonatal tetanus, and other similar conditions. Slave owners were willing to negotiate with Sims for access to these women due to their fertility's economic value if cured. The patients, one of whom was operated on 30 times, suffered from infections and many failed surgeries before they were cured of vaginal fistula. The period between 1845 and 1849, during which Sims operated on enslaved women, was one during which the new practice of anesthesia was not universally accepted as safe and effective. While Sims did not use anesthesia in the experiments he performed on enslaved women, he later used it on white female patients. In 1874, Irish servant Mary Rafferty came to Roberts Bartholow of the Good Samaritan Hospital in Cincinnati, Ohio, for treatment of a head lesion. The lesion was diagnosed as a cancerous ulcer and surgical treatments were attempted. Bartholow saw Rafferty's condition as terminal, but felt there was a research opportunity. With no intention of treating her, he inserted electrode needles into her exposed brain matter to gauge her responses. Although Rafferty came out of the coma caused by the experiment 3 days later, she died from a massive seizure the following day. Bartholow described his experiment as follows. When the needle entered the brain substance, she complained of acute pain in the neck. To develop more decided reactions, the strength of the current was increased. Her countenance exhibited great distress, and she began to cry. Very soon, the left hand was extended as if in the act of taking hold of some object in front of her. The arm presently was agitated with clonic spasm. Her eyes became fixed, with pupils widely dilated, lips were blue, and she frothed at the mouth. Her breathing became stertorous. She lost consciousness and was violently convulsed on the left side. The convulsion lasted 5 minutes and was succeeded by a coma. She returned to consciousness in 20 minutes from the beginning of the attack and complained of some weakness and vertigo. In the subsequent autopsy, Bartholow noted that some brain damage occurred due to the electrodes, but that Rafferty died due to the cancer. He was criticized by fellow physicians, and the American Medical Association formally condemned his experiments as he caused direct harm to the patient, not in an attempt to treat her, but solely to gain knowledge. Additional issues were raised with the consent obtained. Although she gave cheerful assent to the procedure, she was described as feeble-minded and may not have fully understood. Bartholow apologized for his actions and expressed regret that some knowledge had been gained at the expense of some injury to the patient. In 1896, Arthur Wentworth performed spinal taps on 29 young children without their parents' knowledge or consent at Children's Hospital Boston, now Boston Children's Hospital, in Boston, Massachusetts, to discover whether doing so would be harmful. From 1913 to 1951, Leo Stanley, chief surgeon at the San Quentin prison, performed a wide variety of experiments on hundreds of prisoners. Many of the experiments involved testicular implants, where Stanley would extract testicles from executed prisoners and surgically implant them into living prisoners. In other experiments, he attempted to implant the testicles of rams, goats, and boars into living prisoners. Stanley also performed various eugenics experiments and forced sterilizations on prisoners. Stanley believed his experiments would rejuvenate old men, control crime, which he believed had biological causes, and prevent the unfit from reproducing. From 1955 to 1960, Sonoma State Hospital in Northern California served as a permanent drop-off location for mentally disabled children diagnosed with cerebral palsy or lesser disorders. The children subsequently underwent painful experimentation without adult consent. Many were given spinal taps for which they received no direct benefit. Reporters of 60 Minutes learned that in these 5 years, the brain of every child with cerebral palsy who died at Sonoma State was removed and studied without parental consent. Pathogens, disease, and biological warfare agents. In the 1880s, in Hawaii, a Californian physician working at a hospital for lepers injected 6 girls under the age of 12 with syphilis. In 1895, New York City pediatrician Henry Hyman intentionally infected 2 mentally disabled boys, one 4-year-old and one 16-year-old, with gonorrhea as part of a medical experiment. A review of the medical literature of the late 19th and early 20th centuries found more than 40 reports of experimental infections with gonorrheal culture, including some where gonorrheal organisms were applied to the eyes of sick children. U.S. Army doctors in the Philippines infected 5 prisoners with bubonic plague directly and separately induced beriberi in 29 prisoners, resulting in the deaths of 4 test subjects. In 1906, Professor Richard P. Strong of Harvard University intentionally infected 24 Filipino prisoners with a live cholera vaccine, which had somehow become contaminated with bubonic plague. He did this without the consent of the patients and without informing them of what he was doing. All of the subjects became sick, and 13 died. Early 20th century. In 1908, 3 Philadelphia researchers infected dozens of children with tuberculin at St. Vincent Orphanage in Philadelphia, Pennsylvania, causing permanent blindness in some and painful lesions and inflammation of the eyes in many others. In the study, they refer to the children as material used in 1909. Frank Crozer-Knowles published a study in the Journal of the American Medical Association describing how he deliberately infected 2 children in an orphanage with molluscum contagiosum, a virus that causes wart-like growths, but usually disappears entirely, after an outbreak in the orphanage, to study the disease. The author then admits that the mechanisms studied were already well understood and described in literature, so well in fact that he found it unnecessary to go beyond providing basic explanations of the processes at work, stating, quote, "The subject has been so fully described in the excellent paper of C.J. White and W.H. Eobe Jr. that only a few of the important points will be emphasized here." In 1911, Professor William Henry Welch, Board of Scientific Directors at the Rockefeller Institute for Medical Research in New York City, urged staff member Hideo Noguchi, who developed a diagnostic test for syphilis, to conduct human trials. Of 571 subjects, 315 previously had syphilis. The rest were control. The remaining subjects were hospital patients, some of whom were between the ages of 2 and 18 years. The test using inactive syphilis extract was distributed to hospitals which administered it. No subjects were infected with syphilis as it had been sterilized, but the patients were not given sufficient information to consent, breaching the right of patients. It was considered a wrong without injury and a breach of ethics by the Rockefeller Institute. The Tuskegee Syphilis Experiment, Tuskegee study of untreated syphilis in the Negro male, was a clinical study conducted between 1932 and 1972 in Tuskegee, Alabama, by the U.S. Public Health Service. In the experiment, 399 impoverished black males infected with syphilis were offered treatment by the researchers, who did not tell the test subjects that they had syphilis or treat them for the disease, but rather just studied them to chart the progress of the disease. By 1947, penicillin became available as treatment, but those running the study prevented the participants from receiving treatment elsewhere, lying to them about their true condition, so that they could observe the effects of syphilis on the human body. By the end of the study in 1972, only 74% of the test subjects were alive. 28 of the original 399 men had died of syphilis. 100% were dead of related complications. 40% of their wives had been infected, and 19% of their children were born with congenital syphilis. The study was not shut down until 1972, when its existence was leaked to the press, forcing the researchers to stop in the face of a public outcry. In 1941, at the University of Michigan, virologists Thomas Francis, Jonas Salk, and other researchers deliberately infected patients at several Michigan mental institutions with the influenza virus by spraying the virus into their nasal passages. Francis Peyton Roos, based at the Rockefeller Institute and editor of the Journal of Experimental Medicine, wrote the following to Francis regarding the experiments. "It may save you much trouble if you publish your paper elsewhere than in the Journal of Experimental Medicine. The journal is under constant scrutiny by the anti-vivisectionists, who would not hesitate to play up the fact that you used for your tests human beings of a state institution. That the tests were wholly justified goes without saying." Rouse closely monitored the articles he published since the 1930s, when revival of the anti-vivisectionist movement raised pressure against certain human experimentation. In 1941, Dr. William C. Black inoculated a 12-month-old baby who was offered as a volunteer with herpes. The baby developed a painful symptom of the illness and stopped eating during part of the experiment. On the same day, he inoculated a healthy 6-year-old who experienced similar symptoms. He submitted his research to the Journal of Experimental Medicine, which rejected the findings due to the ethically questionable research methods used in the study. Rouse called the experiment an abuse of power, an infringement of the rights of an individual, and not excusable because the illness which followed had implications for science. The study was later published in the Journal of Pediatrics. The Stateville Penitentiary Malaria Study was a controlled study of the effects of malaria on the prisoners of Stateville Penitentiary near Joliet, Illinois, beginning in the 1940s. The study was conducted by the Department of Medicine, now the Pritzker School of Medicine, at the University of Chicago in conjunction with the United States Army and the U.S. State Department. At the Nuremberg trials, Nazi doctors cited the precedent of the malaria experiments as part of their defense. The study continued at Stateville Penitentiary for 29 years. In related studies from 1944 to 1946, Dr. Alf Alving, a nephrologist and professor at the University of Chicago Medical School, purposely infected psychiatric patients at the Illinois State Hospital with malaria so that he could test experimental treatments on them. In a 1946 to 1948 study in Guatemala, U.S. researchers used prostitutes to infect prison inmates, insane asylum patients, and Guatemalan soldiers with syphilis and other sexually transmitted diseases to test the effectiveness of penicillin in treating the STDs. They later tried infecting people with direct inoculations made from syphilis bacteria poured into the men's penises and on forearms and faces that were slightly abraded, or in a few cases through spinal punctures. Approximately 700 people were infected as part of the study, including orphan children. The study was sponsored by the Public Health Service, the National Institutes of Health, the Pan American Health Sanitary Bureau, now the World Health Organization's Pan American Health Organization, and the Guatemalan government. The team was led by John Charles Cutler, who later participated in the Tuskegee syphilis experiments. Cutler chose to do the study in Guatemala because he would not have been permitted to do it in the United States. In 2010, when the research was revealed, the U.S. officially apologized to Guatemala for the studies. A lawsuit has been launched against Johns Hopkins University, Bristol Myers Squibb, and the Rockefeller Foundation for alleged involvement in the study. 1950s. In 1950, to conduct a simulation of a biological warfare attack, the U.S. Navy sprayed large quantities of the bacterium Serratia marcescens, considered harmless at the time, over the city of San Francisco during a project called Operation Sea Spray. Numerous citizens contracted pneumonia-like illnesses, and at least one person died as a result. The family of the person who died sued the government for gross negligence, but a federal judge ruled in favor of the government in 1981. Serratia tests were continued until at least 1969. Also in 1950, Dr. Joseph Stokes of the University of Pennsylvania deliberately infected 200 female prisoners with viral hepatitis. From the 1950s to 1972, mentally disabled children at the Willowbrook State School in Staten Island, New York, were intentionally infected with viral hepatitis for research whose purpose was to help discover a vaccine. From 1963 to 1966, Saul Krugman of New York University promised the parents of mentally disabled children that their children would be enrolled into Willowbrook in exchange for signing a consent form for procedures that he claimed were vaccinations. In reality, the procedures involved deliberately infecting children with viral hepatitis by feeding them an extract made from the feces of patients infected with the disease. In 1952, Chester M. Southam, a Sloan Kettering Institute researcher, injected live cancer cells, known as HeLa cells, into prisoners at the Ohio State Penitentiary and cancer patients. Also at Sloan Kettering, 300 healthy females were injected with live cancer cells without being told. The doctors stated that they knew at the time that it might cause cancer. In 1953, Dr. Frank Olson and several other colleagues were unknowingly dosed with LSD as part of a CIA experiment, MK Ultra. Olson died 9 days later after falling to his death from a hotel window under suspicious circumstances. The San Francisco Chronicle, December 17, 1979, P5 reported a claim by the Church of Scientology that the CIA conducted an open-air biological warfare experiment in 1955 near Tampa, Florida, and elsewhere in Florida with whooping cough bacteria. It was alleged that the experiment tripled the whooping cough infections in Florida to over 1,000 cases and caused whooping cough deaths in the state to increase from 1 to 12 over the previous year. This claim has been cited in a number of later sources, although these added no further supporting evidence. During the 1950s, the United States conducted a series of field tests using entomological weapons. Operation Big Itch in 1954 was designed to test munitions loaded with uninfected fleas, Xenopsilachopis. In May 1955, over 300,000 uninfected mosquitoes, Aedes aegypti, were dropped over parts of the U.S. state of Georgia to determine if the airdropped mosquitoes could survive to take meals from humans. The mosquito tests were known as Operation Big Buzz. The U.S. engaged in at least 2 other UW testing programs, Operation Dropkick and Operation Mayday. 1960s. In 1963, 22 elderly patients at the Jewish Chronic Disease Hospital in Brooklyn, New York City, were injected with live cancer cells by Chester M. Southam, who in 1952 had done the same to prisoners at the Ohio State Prison, to discover the secret of how healthy bodies fight the invasion of malignant cells. The administration of the hospital attempted to cover the study up, but the New York Medical Licensing Board ultimately placed Southam on probation for 1 year. 2 years later, the American Cancer Society elected him as their vice president.